Hey everyone, what's up? This is Dr. Charlie Johnson, PT. Hope you are well. Appreciate you checking out the channel. And in this video, I want to talk about the difference between pain management and pain relief. For those of you new to my channel, I help people all around the world with back, butt, and sciatica problems basically learn to heal themselves using the power of their mind and movement as medicine. And if you're wondering what could be the cause of your back, butt, and or sciatica pain, be sure to check out my Better Than an MRI DIY diagnostic guide, where I share with you sort of the decision-making framework for figuring out the most likely source of your pain. And the reason that this is important is because when you talk about pain management versus pain relief, the question really becomes are you treating the symptoms or are you treating the source of your pain? And so pain management, I used to work with pain management physicians. Really the goal is to do just that, manage pain. And so if you're watching this and you have some type of back pain, be it a herniated disc, spinal stenosis, stiffness in your back, something like that, or maybe you have some pain in the butt, an SI joint problem, piriformis syndrome problem, again, all these things are laid out in the guide. Regardless of what you've been told is the cause of your symptoms, it's like, do you just want to manage that problem, or do you actually, do you want to get rid of it, right? And so if you're looking for pain management, then go see a pain management doc. If you're looking to relieve your pain and get to the source of what's driving your symptoms, then see somebody who is not in the management of pain world, but rather really trying to get to the root cause of your issue. So let me describe and let me go a little bit more in depth here, okay? Back pain, butt pain, sciatica pain, there's lots of causes, all right? And oftentimes it's not clear. In fact, we know that you can get an x-ray, you can get an MRI, and oftentimes you won't be able to really determine the cause, all right? So where does that lead us, right? It leads us to trying to manage symptoms rather than really try to hunt and find the source, all right? And when we talk about pain management, we're talking about pills, gabapentin, Lyrica, nerve meds. We're talking about muscle relaxants. We're talking about anti-inflammatories, pain pills, painkillers, all those types of things. And also injections of many different sorts. All of these things are ways to manage your pain. But again, do you want to just manage it, or do you want to relieve it, all right? And again, this is the difference between treating the source and treating the symptom. So the symptoms, the pain that you're experiencing might be from a disc problem. And so pain management might try to give you injections, might try to give you pills to mask those symptoms maybe coming from a disc problem in your back. But what really caused the disc problem to begin with, right? So we want to go one step further. Well, whether you meant to cause your disc problem to begin with or not, or whether it's your fault or not, somehow this problem started. Most people just don't develop disc problems that become symptomatic for no reason. It's usually the way that they're moving their body, repetitive stresses, or the way they do things maybe at work, the way they choose to lift up a box or bend over and do something else. And so it comes down to an issue with maybe the way you're moving, for example, right? Or the habits, the routines, or the way that you position yourself throughout the course of the day. And so, yes, the disc is maybe the source of the problem in the sense of the tissue source, the pain generator, but what led to that disc getting maybe stressed out or overloaded or becoming a quote-unquote problem or painful to begin with was the way you were moving, again, habits, routines, positioning your body, and just your preference for the way that you carry yourself, maybe, okay? And so on the physical side of things, it probably makes sense then to treat the way that you're moving, educate you on different movement strategies, give you different options for maybe completing certain tasks like bending over and lifting things or doing certain jobs or activities, right? And if you have different movement options and you have more efficient ways to move, ways that place less stress on those discs, for example, then the chance of you continuing to live in pain and or continuing to pick the scab or re-injure that problem goes down. It doesn't go to nothing, but it goes down. All right? And so notice the difference there. Yes, the disc might be the source of your pain, but we're not treating the disc with pills, with shots. We're not trying to manage that problem. We're trying to say, well, what caused that thing to be a problem in the first place? Well, one example could be, again, the way you're lifting, bending, twisting, etc. All right, and so we treat that via education, again, giving you more movement strategies, teaching you ways to modify, tweak, and or change or become aware of better ways that maybe you could go about completing certain tasks or things in your life. And then when you clear that up, guess what? Mr. Disc isn't as angry anymore. All right? On the psychological side of pain, maybe you've gotten lots of x-rays, MRIs, and things like that, and they can't find the disc problem, the piriformis problem, the pinched nerve that you've been led to believe you have. Right? Maybe you've seen lots of different specialists and they're just like, hey, you've got stuff going on, but a lot of this is normal. And we can't really pinpoint it. But I'm feeling this pain in my back. I'm feeling this pain in my butt. So what do people do? They treat the symptoms, not the source. You might even be treating the symptoms. Chances are you're probably treating the symptoms and not the source. You're trying to foam roll it. You're paying to see a massage therapist, a chiropractor. They're trying to realign stuff. And they're kind of labeling you with all these reasons why you might hurt, but maybe they're not 100% sure. Hence why when you go to different people, you get different opinions. If something was that obvious, like a massive disc problem, well, I think that you and I and your other doctors could probably agree upon it, right? But sometimes it's not so clear. And so you have a pain in your back, you have a pain in your butt, you have a pain in your leg, and it's possible, again, that all the people you're seeing are treating the symptoms. They're looking down there. They're pushing down there. They're poking down there. They're stretching all those different areas, but it's just, again, not working. But what's the source? Well, if you understand the psychology of pain, and if you understand that pain is a danger signal, and if there's any type of dis-ease caused by worry, concern, fear, pressure, a life event that happened, a stressor, good, bad, then you realize that this dis-ease within the mind can create dis-ease within the body. You can actually have physical symptoms, meaning it feels very physical, but it's really just a sort of psychological manifestation. All right? Stressors in the mind showing up as what appears to be stress and or damage within the body. And so if that can actually happen, then what's the source? Well, the symptoms or the pain that you feel in your back, butt, or leg. But if symptoms are driven by the mind, then you must treat the mind. So, if you had a rather stressful event in life, and you notice that your pain started around that time, stress puts you in a state of fight or flight, then guess what? You treat the stress. You treat the reaction to your symptoms and the reaction to your pain, and you focus your attention there, not to the symptoms that you feel in your body. So you're not trying to change your physical pain, the pain that you're experiencing, that which feels very physical, but rather you're trying to change your reaction to it. Shift your perspective about what pain is. Educate yourself about what pain isn't. The role of the brain and or the mind on pain. And so that treats the source. Right? And so, to recap, you might have some type of back butt sciatica issue. You might have a herniated disc. You might have arthritis. You might have a piriformis syndrome problem, an SI joint issue, and the list could go on and on. And that might be, if you go to the pain management doc, what they're trying to manage. Yes, they're trying to manage your pain. They're giving you pills, they're giving you shots. They're trying to give you things to kind of address that, what they're saying to be the source of pain. But really it's just the symptoms. They're managing the symptoms, not really the source. You could say, well, okay, again, Charlie, if I have a disc problem, that is the source of my pain. It might be the tissue source, but what caused that disc to become angry? What caused that pain to start in the first place? Probably the way that you moved, some type of habit, routine, activity that you engaged in on the physical side of things, in which case the solution is to treat the way that you're moving and the way that you're living your life and give you a different movement experience and different movement options to reduce the stress on whatever you're told diagnostically is wrong with you, and then your pain fades once you calm that thing down. Or if a psychological stressor kick-started and or was the catalyst for your pain, the mind or the brain, yes, you might feel the physical symptoms that they're trying to manage, but the way that you achieve pain relief is by not trying to just manage those physical symptoms, but by instead managing your reaction to pain and actually changing your reaction to the entire situation. Stress reduction, anxiety reduction, fear reduction, frustration reduction, dealing with the thoughts, beliefs, fears, emotions surrounding your pain experience. Again, if symptoms are a derivative of the mind. All right, and so remember that your diagnosis is a result of probably the way that you've been moving your body and or again, some type of stressor to the mind. It could be either, it could be a combo. And so if you manage your pain, well, then you've probably gone a step too far. And ask yourself, do you want to manage it or do you want to relieve it? If you just want to manage it, okay, but you're probably treating the symptoms. You're probably not actually treating the source, which started the pain. The way you move, and or again, thoughts, feelings, stressors, reactions to life and everything that it throws at us. Okay, so just something to think about, the difference sort of between pain management and where that comes in versus really trying to get to the source and taking an approach of true and complete pain relief. All right, so again, if you're watching this, you have some type of back, butt, and or sciatica problem. Maybe you've just been led to believe that you have to live with this, right? And so maybe you're thinking, this guy's crazy. The only thing I can do is manage these symptoms. It is possible, even if you've had pain for 5 years, 10 years, 15 years. Heck, just worked with a lady who had pain for 30 years. You can actually relieve your pain. There is a way to fully relieve your pain. Now, you'll never live life having no pain. So you might relieve this pain and maybe pain pops up somewhere else. But if you have the right tools, knowledge, and understanding, as well as some support, you can solve the problem. And chances are you can do it much better than anybody else who's outside of you and doesn't actually feel what you're feeling. All right. So hopefully this was useful, again, a talk on pain management versus pain relief. What are you ultimately going for? Let me know your thoughts in the comments. So that's all I got. Thanks, everyone. Chat soon.